Hi everyone, welcome to Wellness Wednesday. I'm Vindira Risalmaraj with By Individual Health and Wellness. So today I just wanted to go over a few things, some questions that I were asked, and also it is National Thyroid Awareness Month. I know it's backwards on my screen, but I'll flip it over later on for you. But yeah, so I want to also talk about thyroid. So since January is National Thyroid Awareness Month, I want to talk about something that comes up often as my work as a registered nurse and as a functional nurse health coach. And so it's about the thyroid symptoms that are commonly overlooked or dismissed. And I actually have a few, sorry, I'm looking at the comments in there. I do have a lot of YouTube videos on this topic, so I'm gonna post that link as well for you so you can watch them and you can save them and watch them later. They definitely do go in depth about the lab work and things like that. So I definitely do want you to research them, write it down, see your provider, and get the help that you need. So one thing that I want to talk about, and it was a recent question that I got asked, and it's something that I also cover like when I talk to my patients when I first started my practice, was how do you handle pushback from providers? I thought this was an excellent question, and it's something that I do tell my clients to go ahead and be prepared when they actually walk into that doctor's office. Whether they say that they're working with a health coach or another provider, or they just did their own research, don't be afraid. I want you to advocate for your health and get the right tests and the diagnoses that you need so you can find your way through your health and wellness journey. So this is how I've learned over the past few years of how to navigate it for myself. So I'm going to tell you what I do, and this is what I recommend that you can do as well, and make, of course, your adjustments as needed. So before I go to my doctor's appointment, I do use insurance, right? And then sometimes I do actually have a functional medicine provider that I also see, which is, he's great. He orders everything that I need. And so sometimes going to a functional medicine provider is much more easier than the conventional because they are looking for a wide array of diseases and tests and so forth. So back to our regular primary care provider when you're using insurance. So I'll walk in with my phone notes, and I actually have like a list of the lab tests that I do want to get done. And sometimes they'll ask me, well, why do you want this done, right? You don't really qualify for certain tests to be run, so why do you want them done? And then I ask simply, well, what would qualify someone to have those tests ordered? So let's say it is for iron and a ferritin panel, right? So the provider might say, well, hair loss, fatigue, weakness, brain fog. And personally, I'm gonna be like, check, that I have all these issues. I want you to go ahead and order those tests for me. And to be honest with you, sometimes that, I've seen so many posts on Facebook. I have clients calling me about these same issues, friends that I talk to, family members as well, about feeling these same vague symptoms. And that's the thing. It can be so many different diseases that are linked to the similar symptoms that we're experiencing. So it's important that we kind of find the patterns and get the help that we need. So I will say, yes, I'm experiencing those. I want to go ahead and get those tests done, and that's it. So they'll order it for me. Now, this is going to be the part that I need you to pay attention to. When you are checking out at your provider's office and they give you that requisition, always ask for a copy of it. Sometimes they do automatically send it over to the lab. That's great. They can do that, but you also want that hard copy because you want to see what they actually ordered. Sometimes when we're just talking to our provider, we're just going over all these things that are on our mind. It is overwhelming. Sometimes insurance doesn't cover certain tests, and so they have to find the other alternative, or it may have just gotten missed. So when you're leaving from your doctor's office, I want you to check that requisition and make sure that it matches the ones that you want to get done. And if you have any questions, ask the secretary or the clerk, or ask the nurse or the medical assistant, or even ask the doctor or the nurse practitioner or the physician assistant, right? Whoever your provider is, and ask them to clarify, like, did you order these tests? There are so many times that I went in there and they didn't order what I asked for. And then I go to get my lab work done and I'm reviewing and I'm like, oh no, they missed this important lab that I really want to have done. So then now I have to go back for another blood draw, which, we want to kind of prevent. Let's just try to go in that one time, get what we need, get our blood drawn, and then get the results. So let's see what else. That's just gonna be the big takeaway. Yes, you may get eye rolls, right? And maybe you might feel afraid to even speak up about your health, but I really want you to advocate for yourself because you are in charge of your body. I know you did not go to school for this, or you don't have any background education. You rely on the medical personnel to help guide you. But we also have to do some research on our own, because health is just so broad. There's just so much things to learn, and we all experience things differently. And so we need to be able to look them up, learn how we're gonna adjust, the lifestyle changes for our body personally. We can't rely on someone else to do that for us. Okay, so back to the thyroid, the thyroid gland. So where is this thyroid gland? And this all links together, because this is one of the things that I want you guys to understand. Like, you have to order the tests, especially some tests that are missed for the thyroid that we do want to check. And it's not just only about getting a diagnosis, it's about finding the way to heal, right? So the thyroid, where is the thyroid gland? So it's right here. Both men and women have it. It's in front of your trachea, your windpipe, and it sits right there in front of your neck. So you can see it right there in both pictures. And so this gland is really essential. So I want to talk about hypothyroidism. So there are two: there's hyperthyroidism and then hypothyroidism. So hypothyroid is more common, not normal, but common. And so I just want to share some of the things that I've learned. So as a nurse, like, how do you know what's hypothyroid? What are your signs and symptoms? And for me, it's everything goes slow, right? So hypo, it's low. And so signs and symptoms would include feeling tired, having weight gain, right here, dry skin, you're constipated, you're feeling cold, you have hair thinning, and you have memory or concentration issues. So this is something that, people are seeing their doctors for. They are experiencing some of these signs and symptoms. And so it's really important that you ask your doctor to test more than just a TSH. Many times we're just going into the doctor's office, or, your medical provider's office, and we're saying we have certain symptoms. They definitely run the TSH. And now I have actually seen in practice so many times that your TSH actually could be normal. And by normal, it could be in the green range, but functional medicine also has its own optimal ranges. But so regardless, let's say your TSH is in the green range, that's not the only thing we can look for. I have seen it where it is normal, but then you actually have antibodies, and they are through the roof. And that's where we have Hashimoto's now, which is an autoimmune disease from thyroid. So I definitely want you to order more than just the TSH and more than just the T4 and the T3. There's so many things that we have to look at, and they all work together. We need to get all these tests done: the TSH, the T4, the T3, the reverse T3, and then the thyroglobulin antibodies and the thyroid peroxidase antibodies. Those are going to be really important that you ask for. And this might be where your provider just only does that one test, a TSH, and says, oh, everything is fine, maybe it's just stress related. We hear, oh, it's just stress, it's motherhood, parenthood. That can't be the only things. And yes, lifestyle factors do make a difference, but sometimes for many of us, having that diagnosis puts it into perspective that, okay, we need to work on our health, because these are the changes that could happen. And we need to work on our health just because we want to prevent further damage in our body. So some of these other labs I would like for you to ask for would be the support lab. So your zinc, your iodine, selenium, and even the complete iron panel, not just your ferritin or your iron. Sometimes it's just only ordered an iron. I want you to order your ferritin too, and the whole shebang, really. Just order as much things as you want. Yes, you're gonna have a lot of tubes of blood being drawn. You can even say, hey, when you go to the lab, can I just run these first few tests, and then I'll come back later in the week and I'll get the rest of the tests, right? Especially if you don't like getting blood drawn, and if it's just too many tubes, that's totally fine as well. Just advocate for yourself. That's really all it is. And when you have open communication, I think it can really help. But you have to find people who are willing to listen to you and to hear your concerns. That's going to be the really big thing as well as advocating for yourself. So I do want you to start looking at your lab work. If you have it right now, if you can access your labs on LabCorp and on Quest, which is great, because now you can see patterns. And that's what's going to be really important. You may not know what they mean, but I still want you to print them out and just say, hey, this is going up or this is going down. Why? And then ask your provider. Maybe just make an appointment just to go say, hey, can we just talk about my health for a minute? Because I'm kind of confused and I want to know. I think that's okay. Or even some providers even allow you to just message them. And I think that's wonderful as well. You can even just say, can you point me in the right direction? Can you send me some links? I think it's important that we start asking questions to the medical professionals, because they are the ones who are leading our health and, you know, guiding us. And so I think it's okay to ask questions. I mean, if they need to see you for an appointment, sure, go make an appointment and go see them. So back to the lab, you can print them out, you can view them. Quest is amazing. They have this line graph that you can see your trends over time. So you could just pick on a certain lab, and there you go. You can see like your B12 levels. You could see it go high, low. You can see the actual numbers, the values, and that can help you find so many different things. And I don't want you to just look at the one lab itself. We should not look at labs in isolation, but together to paint that whole big picture. So again, like for the TSH, you wouldn't just check your TSH and just look at the patterns over time. You want to check all of these labs and see over time what's going on with your thyroid health, as well as your signs and symptoms. So that's all. Another thing that I want to add was the subclinical hypothyroidism. So sometimes we don't pass that threshold, right? We're right underneath that thin line that says, hey, you have the disease versus you don't have the disease. But doesn't mean that we can't start making changes to our health. That's what's really important. We know we feel these signs and symptoms. We know we're feeling tired, we're having weight gain or even weight loss. We know that our hair is thinning. We know that, we're just not remembering things how we used to. These are all important. They're still going to exist, whether you have a diagnosis or not. And just so you know, having chronic disease diagnosed like type 2 diabetes, hypothyroidism, these do not happen overnight. They actually happen for years. That's why it's important to track the trends and see the patterns. And, like one of the things was triglycerides. It can be a predictor of diabetes type 2 in 10 years. So if you have elevated triglycerides and they just keep going up, that's a really good sign that something could be, amiss. So we need to check it out. So those are the patterns that I'm talking about. We're not just going to use, yes, it's triglycerides. We're just checking out the one there. But it's just, you're going to look at the whole picture. You could even do the fasting glucose, looking at that in addition to the triglycerides, looking at your A1C, looking at all those trends tells us how we, and, looking at how we feel, that creates that big picture. So some of the lifestyle things I want to talk about for the thyroid, right? So if we are experiencing these signs and symptoms, some things that we can look at are what we're eating and drinking, right? A big thing with thyroid health is having a gluten-free diet can be beneficial. Maybe even being dairy-free can be beneficial, as well as egg-free. There are certain things that we can do to promote our health, right? Our thyroid health. Now, if you don't want to give those up, that's totally okay. But you just have to look and see what you're eating. The quality of the foods is going to be really important. Are you eating eggs, but are they in the containers that they have added ingredients to versus eating a whole fresh egg? Those are things that we're talking about. Like, let's eat the things that are not so full of preservatives, but that are more wholesome. We need to check out our sleep, right? Sleep is very important. We don't prioritize enough sleep these days. We're always on the go. We're so busy. But sleeping really helps regulate so many of our hormones in our body, especially like the eating, right? If you're the satiety and the hunger hormones. And so if our sleep is off, we're definitely going to be more hungrier, and that can lead to the weight gain, right? That can cause the imbalance. We're going to pick whatever we want to eat. So stress is another one. If we're stress eating, what kind of stuff are we eating because we're stressed out? Are we pulling all those processed foods, that have all those additives inside of it? And then how are we eliminating pooping, peeing, and sweating? Are you sweating daily? Are you peeing clear? Are you pooping every single day? Number 3 to number 4 on the Bristol poop chart. Those are significant in letting us know how our body is functioning inside. And that helps us to know if, the toxins are building up or if they're being excreted. So I know that this can be overwhelming. And so I want you to just take it one step at a time. So if all you can do is focus on stress management, then do that. Focus on stress management and tackle that. If you need to do 4-7-8 breathing, watch a YouTube video on what that is. If you want to do box breathing, look at a video and do that every day. If you want to go for a walk, that's how you relieve stress, then do that every day. If you need to get fresh air, do that every day. If your sleep is feeling off, then work on that, okay? Maybe certain foods are affecting your sleep, again, so like caffeine or chocolate after 2 p.m., maybe just those little small habits, just don't have those foods or those drinks after 2 p.m. Maybe that might help you. And then just tracking what you eat and drink and how you sleep, that can bring a lot of clarity as well. So all these things are what you can be looking at to help bring you back to the health, on the health continuum, back to health and further away from disease. So just making small changes, you do what you can, that's going to be the most important thing. And that's all. So do what you can and where you are. So if you have any questions, I would love to hear them. Please do comment, watch the replay, let me know what you think. And that's all. I hope this was helpful for you, and I will see you next Wellness Wednesday. Thank you and take care.